Welcome you all for the free Zoom webinar, Zoom meeting on medical astrology. Today is a very auspicious day, and Saturday, Saturn is affecting on us. And before starting our session, I would like to chant Saraswati, who is the goddess of knowledge and education. So reciting of Saraswati, the goddess gives blessing for us and to bring the knowledge for us, to empower our clarity of mind, memory, happiness. So I would like to chant Saraswati. Saraswati Namastubhyam Varade Kamarupini Vidyarambham Karishyami Siddhir Bhavatu Manasa. Om Shanti 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 Harihi Om. So welcome you all. So now I would like to invite our co-director, Dr. Om from Bangkok, Thailand. Dr. Om, please welcome.
Namaste and greetings to everyone who has joined here. I believe you are from the different parts of the world, from different time zones here. So, greetings of the day to everyone, and thank you for having spared your valuable time to join on this webinar. And I'm sure that you will be able to get some very valuable information from this webinar. A little brief about my own self. My name is Dr. Om. I'm a naturopath, bachelor's in naturopathy and yogic sciences. I combine naturopathy, Ayurveda, and medical astrology in my health consultations. I offer health consultations to people all around the world. And for those who are able to get consultations with me face to face, I also take Nadi Parikshan and Jiva Parikshan, the pulse diagnosis and tongue diagnosis. Well, tongue diagnosis I also do for the people who are overseas because they can at least send me the pictures of the tongue, and that gives me a reasonable insight about what is the plight of their internal organs. So basically about my educational background, I got most of my education from India and Thailand and advanced my master's in business administration from the University of Reading, UK. While we were growing up, and as many of you might relate with it, that if you were good at studies, your parents were already dreaming of you becoming either an engineer or a doctor. And I became a doctor. I became an engineer. So that's like a very modest and polite way of conveying that, yes, I was good at studies. Well, jokes apart, I became an engineer. I worked with various multinational companies and got exposure to different cultures around the world. And deep inside, yet still, I wanted to become a doctor. And that kept me very close and attached to the subject. I kept reading, studying, and also interacting with my friends who were in the medical field. And eventually, after over 30 years of working for different corporates in the engineering field, I thought of really taking a formal education in medicine, and I chose naturopathy because all this while I was always very inspired by the natural healing and the energy concept that is involved in the healing process through all these natural modalities. Now, since childhood, whenever we fell sick, our parents always used to make some natural concoctions and offer us to drink them or eat them, and we would get back in good health. So this kind of natural modalities always fascinated me, and also that since it does not provide any side effects, so that was the key motivation, and that kept me very keen on learning on this. And I took some formal education as bachelor's in naturopathy and yogic sciences, again from India. And this was helping me to also be able to help others, in the sense that ever since after COVID, in fact, I used to get more consultations around the health issues, and fortunately or incidentally, people's faith and belief in the natural healing modalities got increased, and they used to be more open to accepting these concepts. And that kept me really engaged with helping people out with their health issues, and gave good consultations to them around those times. And since then, it is more like my health consultation engagements have increased quite a lot. And now I am like having a lot of consultations from the health point of view, as well as from the other fields of services that I'm into. I'm still doing a bit of engineering projects, and also some few educational projects that I have my hands on right now. Um, Coming back to our concept about healing, I was fascinated with healing from the nat or the wanted to always also learn about astrology. Since childhood, I have been reading about astrology, and I'm fascinated with the concept of how planets affect our health, or what is the health implications on us. So that gave me a little bit more insight about how each of these planets impact us, and why we have to be considering the impact of those in our day-to-day life. Now, whenever we may knowingly acknowledge it or not, or we may appreciate it or not, but the energies of the planets, they do impact us 24/7. And they, for example, if we consider the food that we have on our plate, the main source of energy that we get our energy from, this is nothing else than the transformed energy of the sun, right? Imagine if sun were not showing up, and or it went on a vacation for a week or month, where would all the vegetation be, And so whether we are a vegetarian or a non-vegetarian, all our food is getting the energy from the sun. Likewise, there is also the impact of the energies of the other planets, and this has impact on our health as well. So that kept me more interested in medical astrology. We will discuss more about it in our further discussions. And well, regarding our association with Dr. Shekhar, In fact, we met here in Bangkok in one of the conferences on Ayurveda, and it was really very, very interesting, and it was almost like love at first sight. Well, in fact, both of us are from the same background, though, again, it is before we start thinking wild about it, but both of us are happily married, and our spouses are also well, thorough professionals and high-end tech professionals in their own field. My wife is a bank professional, and his wife is into IT. So, but what charged me or made me very, very happy about meeting Dr. Shekhar was his commitment to the healthcare and his vast experience in the field of Ayurveda. And I got really inspired by the zeal and the energy that this couple, both of them, shared about propagating the healthcare through these natural modalities. And this is a part of our Vedic wisdom. And there is a lot of synergies that I could see between my line of services or work and his. So that kept us on discussions for quite some time, and eventually he also asked me to share my knowledge on this medical astrology, and that's where we are talking about this on this great subject. So let me just quickly now run you through a presentation on the topic, and I will explain how it is relevant and how and why all of us should at least have the basic understanding of the astrology, and also especially the medical astrology side of it. Because my personal motto in life is Loka Samasta Sukhino Bhavantu. And I'm sure many of us, the participants who are joining in this webinar, are of the same mindset. So when we talk about Loka Samasta Sukhino Bhavantu, we say, may all the beings on this earth be happy. And we cannot imagine happiness without good health, be it any amount of success in our personal or professional lives we make. Unless we are physically, mentally, emotionally healthy, we cannot enjoy any of that success, right? So that's what I want to explain on how medical astrology can help secure good health, and how and why it is important to understand at least the basics of medical astrology to everyone, no matter what background you come from and what your experiences in life are, or whatever you may be going through. So let me just share my screen. Is my screen visible?
No. No.
Wait a second.
Click on this.
Yes.
Wait.
Yeah.
Does it show up now?
Yes. Yes, now we can see.
Okay.
Yeah,
all right.
that's
So
it.
that is the science of medical astrology that we are going to talk about in very brief, like a high-end overview of what medical astrology is. That's a brief introduction about me, and I think I have already discussed about it briefly so that we can skip over this page. So what is astrology now? Astrology, as we all know, is the study of the celestial bodies on the human life, while medical astrology in particular focuses on the health aspect of it. Astrology overall can give the insights about various life incidents and the various phases of the life from birth to death, what an individual goes through, including relations, professional, personal life, or the plight of finances and whatnot. But medical astrology mainly focuses on the human health, considering the aspects of physical, mental, and emotional components of the health that are very important individual to secure an overall good health. So when we see an astrological chart, now an astrological chart has 12 houses and the 12 zodiac signs and 9 planets. We are considering about the Vedic astrology, and in the Vedic astrology, we consider Sun, Moon, Mars, Mercury, Jupiter, Venus, Saturn, Rahu, and Ketu as the various 9 planets. Sun and Moon are also considered as planets. And each of these planets being present in different zodiac signs or houses in an individual's birth chart, that is basically considering the time, date, and place of birth, the individual's birth chart can be generated. The placement of the planets in those particular houses or zodiac signs, it impacts the native's physical, mental, and emotional well-being. And that is what is studied through the readings of those birth charts. Now, analyzing the birth charts, we can gain certain insights about what are the health aspects of these individuals going to be likely, and identifying certain health issues that the individual may have to go through, even being able to predict the timing and the extent of impact that could be exposed. One can even offer the remedies and suggestions for rectification. We can even protect certain damages from happening if we have this information before. So each of these zodiacs and houses, incidentally, it relates very interestingly to the physical body parts of an individual. For example, Aries, we are talking about the zodiacs, for example, here. Now, zodiacs, Aries represents our head and face. So the brain is related to Aries. Taurus represents our throat and neck. And of course, there are more details to it. And since now this is just an introductory presentation, I'm sort of giving you just a very high level overview. But very, very fascinating to find that each of these signs represent certain physical organs of the body. And any relations of certain planets can actually indicate certain health aspects. So Gemini represents our arms, shoulders, lungs. Cancer represents the chest or breast or the upper stomach area. Leo represents heart, liver, and also the upper back. Virgo represents our lower abdomen and the organs present in the lower abdomen. Libra represents kidney and also the lower back, portion of the lower back. Scorpio represents the urinary bladder and reproductive organs. Sagittarius represents the hip and the upper thighs. Capricorn represents knees and bones or the joints related to that area. Aquarius is related to the calves and ankles, and Pisces represents the feet and the lymphatic system. Now, again, this is a very high-level overview, and there are very much minute details that we could go over. But for our initial discussion, I just wanted to limit it to a very high-level concept. So, like, for example, here, this picture shows very clearly about how from head to toe, each of these houses and zodiac signs relate to the human body. And it's absolutely fascinating to see if we were to investigate or read certain health issues in an individual related to certain organ, we can actually see the linkage of the houses of the zodiac signs and certain planets which are present in his or her chart. And it can give you just like an MRI, we can have the insights of the individual's internal organs. That's totally fascinating. See, for example, here, Aries and the first house represents the head and face of the person, and Taurus or the second house represents neck, tonsils, throats, larynx, etc. And Gemini and the third house represents shoulders, lungs, arms, and the fourth house or Cancer represents chest and stomach and the diaphragm and the breast. Our Leo or the fifth house shows the solar plexus and heart and back, the upper back. The sixth house, Virgo, represents large and small intestine, as I said, about the lower abdomen area and the lower back. And Libra or the seventh house in the astrological chart shows the pelvis area, the kidneys, and the other related organs around. The eighth house shows the reproductive organs also, and also the rectum and the anus. Ninth house or Sagittarius shows hips and thighs, and also the 10th house shows knees. Aquarius, the 11th house shows the lower legs or calves, as I said, and Pisces shows the feet, and Pisces or the 12th house shows the feet, etc. Now, when we were reading any individual's chart and trying to investigate on the health aspects, although we should be reading the chart in totality, however, some of the very important houses that we should keep our eye on are the first, the sixth, the eighth, and the 12th house. Because the first house, which is also called the ascendant, is the one that represents overall health and vitality of an individual. The strength of the ascendant, the strength of the lagna, as what it is called in Hindi or Sanskrit, the first house, the planets present in the first house, and their strength, the good or bad planets, if there were, that would impact the overall health of the individual. And be it the overall immunity is directly seen from the first house. If a person has a weak ascendant, has a weak first house, he may be catching common cough and colds also very easily, while if the person is having a strong ascendant, he may be able to withstand even tougher health issues and come out victorious. Sixth house shows generally the diseases, the disturbances, or the ailments that creep up in individuals' life, the general uh, botherations that happen in one's life is seen from the sixth house, because sixth house is the house of daily routines also, and that's why it is very logically relatable for the fact that if we were not religious or not disciplined in our daily routine, we are inviting diseases. So that's so very, very easy to understand that if we were taking things lightly, we were not focusing enough on our lifestyle on the day-to-day level, we are definitely inviting diseases down the line. So it is the creation of diseases is also somewhere in our hand, and that is seen from the sixth house and the Virgo sign. So this is also something very fascinating that we can read from the charts. And whenever I get to see one's chart, I quickly look at the sixth house, and if the placement of the planets and the strength of the house looks good, yeah, so that means the person is disciplined and he's taking good care of the health issues. But then if the issues are coming up, there could be some more reasons to investigate. Now, eighth house represents chronic diseases, the diseases that are taking much longer a time to heal or to get the remedy for. And 12th house is the house of hospitalization, any issues, any health issues or problems that may require the individual to get hospitalized are seen from the 12th house. Now, those can be several issues. If we go into those details, then the presentation may run very long. And if actually time permitted, I would have loved to share some charts of the individuals and share some more insight about how we see that. But for this presentation, I think let's keep it to a high level. Now, looking at the planetary positions in one's chart does not mean that he or she may suffer those health issues all their life, all the time. It is also during certain planetary periods, certain timings or transits, certain mahadashas or antardashas, as it is called in astrology, that the individual's health issues will surface very prominently and affect or disrupt his daily life. So to say that the person has got certain combinations which are possibly detrimental to the health and then he will have to suffer all his life is not really true. It is only during certain planetary positions or conditions or mahadashas or antardashas in his life that if he has the promise, if there are combinations existingly present in his astrological chart, that the individual will have those certain issues. And if he or she is taking prior precautions on those aspects, then the damage or the suffering can be reduced to a great extent. Malefics transit over sensitive houses can trigger illnesses. Now, what are malefic houses? In astrology, we have the concept of benefics or malefics. The benefics are basically the planets that are providing favorable results to the individuals and bringing comforts and peace or happiness in their life, while malefics are certainly the planets that pose more challenges in their life. So it doesn't mean that they are always there to harm you, but they are there also probably to give you certain lessons and make you more disciplined or more focused on your own issues. So we will again go into more details about it in our fewer other Zoom sessions. If so. Now, healthcare through medical astrology. Well, medical astrology can help provide personalized healthcare, as I said, through the insights of the individual's astrological chart, and having analyzed those charts properly, we can understand what are the health risks that the individual could be susceptible to, and having a prior information about those and taking timely actions does provide easy management of those health problems. That is the most important objective of any health consultation that I take up, and that's what I try to advise people around. And then there are remedial measures around naturopathy or Ayurveda, and there are several mantras or holistic way of life that we can adapt. Even certain gemstones can help, and becoming more spiritually aligned can also help balance our planets and reduce those damaging or harmful effects of those situations that could have otherwise done greater damages. So there's often a question, why medical astrology? Well, while there are several, fortunately, in today's world, we have technologically advanced quite well, and our medical facilities are very detailed, and we are able to get the health aids quite better than what we were having earlier. But it is not really possible for everyone to be able to get access to those medical aids, and also they're not cheap either. So that's where medical astrology can be a solution for a common man. And that is my main objective here. And that's exactly, again, going back to my earlier motto, what I said, Loka Samasta Sukhino Bhavantu. We can expect good health for everyone, even through a small health consultation. If they could get some better insights about their own health, and then it is possible to take preventive and holistic approach to maintain good health. And it is like providing some early insights can help them to manage their own risks. For example, if someone knew that he has a possible tendency to develop diabetes, for that matter, or cholesterol or fatty liver now, which is like every other person now, 6 out of 10 people in today's world are having a fatty liver. So if one was able to read that from one's chart, then simple lifestyle routine corrections can prevent fatty liver. And we all know what is eventually going to happen after fatty liver. So all those subsequent health complications that were apparent down the line can be prevented. So medical astrology helps provide the root cause analysis. We're not only talking about surface symptoms, which is mostly now our medical treatments are focused on, and then it is only the medication to let only the surface issues disappear. But while the root cause is still there. So here with medical astrology, we can even get to understand what is the root cause and what can be the preventive measures to take in time. again, understanding about the planetary influences already discussed, and customized diets and exercise and daily routines. These are certain things which every commoners can do, and that's how they can secure the good health by all natural means. Now, medical astrology, how is it linked with naturopathy and Ayurveda? I think now what I have discussed so far explains quite a lot already how medical astrology can complement naturopathy and Ayurvedic treatment approaches, because both these modalities are about natural healings through the diets, through the herbs, through the lifestyle correction, through even balancing our energies. Like in Ayurveda, our approach is always towards balancing the life force energies in the form of Vata, Pitta, and Kapha. And from a medical astrology consultation, one can even understand what is the individual's body type, what is the prakriti, and what are the possible vikritis that the individual may go through certain dashas, and how they can do some timely corrections, even like taking some panchakarma treatments before the doshas aggravate to a level that they come as serious health ailments. So that's how medical astrology can complement these natural health care modalities. I consider medical astrology as a pathway to empowerment, because I believe astrology is knowingness, and knowingness is power. And through medical astrology, we are actually knowing our own self. That's the opportunity for us. That's how, as I explain to my clients, that any health consultation and through medical astrology is just like doing a SWOT analysis that we normally you do in the corporate world. We try to understand our strengths, weaknesses, or the opportunities or threats. And here in we are understanding what are our strong points, what are the weaknesses, and what are the possible threats that we may be exposed to, and what are the opportunities that we may avail to get ourselves in better shape and be able to transform our life force energies in a direction that we can make purposeful use of our existence on this earth. We are not here to only suffer disease and then go one day. We all know we have to leave this body and go, but we are not here to only suffer the diseases. We can remain very much in good health through these modalities, the natural modalities that the Vedic knowledge has provided us. And by drawing focus on these on time, we can actually be able to remain healthy and do much better in our lives. That's what my philosophy or understanding is. So I believe this was a very, very brief and overview of what medical astrology is. And I hope I have been able to do some justice to the whole concept, and you have got some idea of what I'm talking about and how it benefits. Here, this is my contact information, and you pit video. You pit video.
Yeah, you can stop sharing.
Okay. All right. I will now stop sharing, and I will hand over to Dr. Shekhar.
Good. So thank you. Wonderful presentation by Dr. Om, and such a wonderful brief introduction to the medical astrology. Myself, Dr. Shekhar Annambhotla, a classically trained Ayurvedic doctor, practicing more than 35 years of Ayurvedic medicine. I studied Ayurvedic medicine in India, 9 years of medical school from the two medical schools, universities from the Andhra Pradesh Nagarjuna University and as well as Gujarat Ayurveda University. I graduated in 1991. So after graduation, I extensively traveled in the European countries and Latin America and USA and North America, and finally settled here almost 25 years in the United States of America. I'm an American citizen. So this global Ayurveda Academy, which is globally connected to the lot of practitioners, students, and everything. While I am doing practicing Ayurveda in the European countries, I was exposed to the Maharishi Mahesh Yogi. His vision is a Vedic approach to health. Health is not only giving of Ayurvedic aspect, it is also related to some level of astrology. Medical astrology is very important tool. Like we look into that, a medical doctor who studied general medicine, MD, family medicine, and there are specialists are there in the specialization, kidney specialist, skin specialist, cardiologist, gynecologist, pediatrician. These are the subdivisions are there. And super specialties are there. Neurosurgeons, neurophysicians, cardiovascular surgeons. So these are the specialties, specialties comes. Similar way, Jyotisha, the Vedic astrology is a wide range. In that, we have divisions are there. Some people, when they are going to the astrology, they always look for the matrimonial marriages and everything, compatibilities and everything. They look into that. Second aspect is that they go into the, when they are house, new buying the house, what is the best place to go and buy the place, and what is the ideal place where to live and everything. That is an other aspect like that. Or when they are doing businesses, what is the best auspicious time and when to do it and everything. That's the thing. So this is the thing what we are trying to do. We are not covering of a lot of subjects like that in those areas. We are not looking for the compatibilities and everything like that, marriage, counseling, those type of things we are doing. We as an Ayurvedic practitioners, as an Jyotishi experts and naturopathy doctors and health professionals, we are pertainingly looking into the more Vedic astrology and Vedic astrology, which is particularly to the medical astrology. So as Dr. Om mentioned clearly to us, how the planets, various planets, how they are connected to each other. So as we look into that, Yada Pinde Tada Brahmande means microcosm to the macrocosm. Whatever we are seeing inside in the chart, it is exactly outside. So everything is outside, inside is happening there. For example, a person, I'll give an example for you. A person is suffering with the kidney stones or gallbladder stones. In particular time only it is happening there. And there are maybe some Ayurvedic perspective, we look into that. Maybe they are not eliminating properly and not detoxing properly, and elimination issues are happening there. The kidney area is affected, and then kidney stones formed. Or excessive pitta-genic foods they are eating that may lead them to go for the uh, bile stones, gallbladder stones. So, is it a medical or surgical? When it is go for surgical aspect, that is the thing. All the things, what is the medical astrological aspect, it can share with us, and it can be manageable with the medicines, or it has to go through the surgical procedure. So when certain planets are influencing on the particular chart, definitely he has to go for surgical aspect. There is no way to do it. And then again, the sometimes surgery, some can be fatal, and it leads to patient can go into the traumatic cases and complications can develop and everything. So that is a lot of people, when they are fearful, worried about that anything surgical procedure they are going through, that their first thing fear is that any side effects are there, long term effects are there, and everything can happen. Nobody prefers to go for surgery. They try to manage through the medicines and medications and yoga, Ayurveda supplements, homeopathy medicines, or naturopathy medicines, or some acupuncture training, therapies, those type of things they wanted to do it. Through that, they try to mitigate the problem to suffering. So it's a very fascinating for me while I was doing in the European countries practice of that. I have always having an astrologer is with me. We do the health consultations. We always look into that. And a person coming with complaint with the psoriasis or skin disease, and definitely there is a possibility that they have some level of some pitta-genic imbalances are there according to Ayurveda. Pitta vata diseases are there, kapha conditions are there. Then medical astrology, Vedic astrology, what planets are influencing that, and we can predict it when it is going to be recovered, and faster relief what we can do it. And for that, how Ayurveda gives simple remedies like that. Okay, use some coriander, cumin, tea like that you can drink. But at the same time, what the planets are influencing on your body, maybe you can do sun salutations or praising of the sun, Aditya Hridayam. There is a one chantings, simple chantings, which you can perform yourself at home. Or obstruction, removal of obstruction like the Gam Ganapataye Namaha, Om Gam Ganapataye Namaha, some chanting of mantras and everything can be taken. But if the beyond that level is there, then you need to have Vedic performances such as some homas, yajnas can be performed. That's expensive. Then wearing of some gemstones that also can help you. Sometimes wearing of garland, something like that, talisman, those type of things also can be taken. Those things can help you to mitigate the problem, and you will be ultimately healthier. And it can also help you that longevity of life can be improved. Your overall health can be improved. As we know that health is wealth. If you have a lot of wealth is there, no use if you don't have good health. So health is a very important aspect. We as an Ayurveda practitioners, we as a practitioners of our health, all health professionals definitely has to take this course. When they started taking this course, step by step we'll go through the process like that. We have this, we have created this program, 5 levels: basic level, beginners level, intermediate level, advanced level, master level, a doctoral level. So that means you, as you are advancing more and more knowledge, you are gaining more knowledge. Can I go to the directly to the doctoral level? No. You need to know the basic level of understanding of beginners level of the training. And there you have to do some homework and assignments and everything has to be done. So basic level, which we are going to do 8 webinars or meetings, webinar meetings, Zoom meetings. In that each webinar will be 2 hours. That means 16 hours you are attending the classes. That is almost like a classroom setup, 16 hours. Remaining 36 hours, you are going to do some research work. Some projects, we will give the projects for you, whatever subject we covered. And then we give you have to write about a 500 to 700 words of a document. How the planets are influencing on your health aspect. So various topics will come. So according to the students, the group of students who are participating, Dr. Om and myself will come up with some topics and projects. We'll give it to each and every student. Each and every student has to present it among in the group presentations. They have to do it, presentation. Then what we do, that document is edited by the peer-reviewed experts in the field of astrology. They will review the document. After editing the document, we'll post the document on the website, in our website. That way it is accessible to everybody. So the student who completing the project is a student, is guides, and as well as editor. Everybody review it systematically. Then it will be published there, and then it can be read by anybody can read it. So that way it will fulfills your a complete training program beginners level. Then you go to the next level, intermediate level. Then it advances in 8 webinars to the 16 webinars. So multiply, it multiplies 8, 6, then 32, 64, 128. Like that in the different levels of levels, you are advancing the more and more training programs. So it is a very systematic, it is not like an overpowering for you and it gives an very understandable like that, slowly digesting your system and everything understanding. First basic level course is very, very important for us to learn. So for that, we will ask Dr. Om about the what day is a good day. We are thinking about that what day is a good day to start. A lot of people they think about Saturday is good day and everything like that because Saturday, Sundays are people are not working and everything. But what we decided that it's a very auspicious knowledge and divine knowledge. We should start and in a very auspicious day. Thursday is a very powerful day to knowledge gaining. So what we decided that to do it on Thursday, every Thursday, if the student is not able to participate in the class, they can watch this video clip. We will send it to them. As registered students will get this recording. They can watch at their own time. And as we see that convenient time, we will look into that and we will work on that. Our tentative date of beginning of this course in July 10th. July 10th is Thursday. July 10th is a very auspicious day according to astrologically. That is the reason we are thinking about starting of July 10th. Until that, we'll have a continuous webinars will be there. A free webinar, Zoom webinars are there. We are expected to have minimum 100 students to be in the class, in the beginners level class. That way, once we enroll 100 students in our webinars, then they can take them to the next levels, further levels like that. So that way we can expand more and more training programs like that. So we have vision, we have clarity, what we wanted to do, how we wanted to do this program, and whom we have to invite as an guest lectures. We will also invite exponents of the guest lectures. Today I was just talking to one of my good friend who is a Ayurvedic doctor and also medical astrologer, Dr. KSR Prasad. So I talking to him. Would you like to be a adjunct faculty member for these things? We have Pandit Dinesh Chandra Sati from all the way from Rishikesh. He lives in Himalayas, Rishikesh. He's a Jyotishi scholar, expert, and we are going to ask him to be a adjunct faculty member. So we are going to, as you are showing more and more interest, you are hungry for the knowledge, we will bring the experts into the field to teach you some of the classes, some of the webinars can be done online. And we have a big vision also that we wanted to conduct a medical astrology, international medical astrology conference, exclusively medical astrology conference. And in the medical astrology conference, you can be, as the students are advancing their knowledge at their level of training, they can be presenting in the conference also. They can be speakers in the conference. They can share the knowledge. That way you will get a confidence like that. And people who are good presenting in the conferences and everything, the evaluation team will be there, judges will be there. They will be able to give certifications for you and awards also we can give you. We wanted to encourage the students to learn more and more. And of course, we are also students for lifetime students. It's never ending. We are always learning more and more knowledge and expanding our knowledge and everything. So this is the very important for us to know about these things. I think I hope you understand the levels of training is 5 levels of training: basic, intermediate, advanced level, and master level and doctoral level. In the doctoral level, when you are coming to the doctoral level, you will be able to write a thesis, dissertation work. You are able to see all the clients and their health problems and everything. Simultaneously, you are also learning from the Ayurvedic perspective as well medical perspective, diseases oriented, Western medicine diseases and orientation, as well as with the medical astrological levels like that you can planet influences and everything that are. So this is the thing is a missing link. In the missing link, this is the medical astrology is a missing link. It is a puzzle. So a lot of times Even though I am going through the Panchakarma therapies and Ayurvedic herbal formulations I am taking, acupuncture I am taking, chiropractic I am taking, and medical doctors I am seeing, but still my disease is not curing. What is the cause for that? So we have to see the planetary influence also can creating the problem like that. That is the reason the puzzle can be solved by incorporating the medical astrology. So that is the reason Dr. Om and myself, we had a long conversation, continuous conversations over the phone and WhatsApp and FaceTime and everything. We do the meetings like that and in-person meetings like that. We had a wonderful timing conversations like that. So this is the reason this puzzle how to solve. Being an naturopathic doctor and Ayurvedic doctor and health professionals, we always discuss these areas like that. It fascinates for both of us and this thing. We wanted to bring that deeper knowledge and everything educational program to it. So a lot of people are studying Ayurveda, health counselor, practitioner, food and nutrition consultant, so many things they are doing, but astrological consultations can be done properly and systematically, learn more and everything properly, and see how the influence on your health is happening there, how the things are there, certain chronic disease. Nowadays, we can look into that more and more people are having this we are going to do these programs like that so generally somebody asking that when on Thursday what time you are going to start we are thinking about that because as we know that exactly 12 hours time zone difference between the Dr. Om and myself. So we as a teachers, so if I am sleeping, he is awake. When he is awake, I will be sleeping. We are opposite, completely opposite side. Okay.
I think we have
So,
11 hours difference, right,
so
Doctor?
yeah, 11 hours, 11 to 12 hours, because as the time zone changes like that, 11 to 12
Yeah.
hours difference is not much difference like that. So we decided that morning 7 o'clock Eastern Standard Time, so 7 a.m. to 9 a.m. So before my patients, clients and starts, my Panchakarma therapy starts, we'll be able to do 2 hour session. That will be around 6 o'clock in Bangkok time, 6 to 8. That time will be there. So even if you miss the class, the entire recording will be there. Whatever we taught, will as soon as we finish the program and everything, we'll share with you with WeTransfer. Then you can download it to your computer. And also we are going to do webinar 1, webinar 2, webinar 3, webinar 4. Like that we are going to put webinar numbers and the topic. That way you are able to track it. If you are able to download it and everything, you are having any difficulty of downloading and everything, we have archived this all the files. Then we will be able to send it to you. Make sure that you will have all people having 8 webinars in your hand. Then we may come up with some questions and answers like the questions like that. That will be shared with you, assignments, anything we are sharing that way. Only the registered students only will get this information, registered people. And after completion of the training program, they have to do, so for example, every week we are doing, in 2 months, you will be able to finish 8 classes. So every Thursday we are doing, in 2 months period of time, you will be able to finish beginners level program. So after finishing of the beginners level, we'll give a 2 months time for you to complete the project and assignments. So what happens during the 2 months period of time, we'll discuss what assignments has to be done based on your knowledge and the performance. Then we'll have a one more meeting with all of you, all the students, 10 minutes talking about their project and information and present it one by one among the students. Then we'll have some review is there. You will also develop a confidence. Hey, I am also becoming a good teacher. In future, as we are advancing our knowledge, we cannot able to do these programs continuously. We wanted to invite you, our students, bright students, to come and speak as a faculties, to come as a faculty like that. We'll pay for you. We'll pay for you as a faculty to teach the programs. And that's the way it will grow more and more. We wanted to have involvement of the things. And we may do the conferences. First, we launched the 2 programs, one in the USA, one medical astrology conference, and one conference in Bangkok. That way you can have some sightseeing is happening there in Bangkok. Come for 2 days program there. We have wonderful facility there, Kayamana Center in Bangkok. Master Kamal, Grand Master Kamal, he has a beautiful center there, and within the city, Udumsuk, where we can have a conference can be done, and in-person conference can be done in physically. Then what we do, you can have some sightseeing and enjoy the things, all the city and everything, culture and behavior and these things like that. Then you will enjoy the time. At the same time, in the USA also, we may do conference like that. We have in the USA, and then we can go to the Canada and other places. We can shift according to that, where we can do students. Number of students are more in the particular country. We can go to England. We can go to Caribbean islands. Somewhere beautiful places. We can do the medical astrology conferences regular basis like that. So that way we can meet with all the people knowing about that. Basically, we'll invite the students as well as some expertise who are expertise, some of the experts who are well known for 30-40 years. They are practicing of astrology, medical astrology particularly. We wanted to bring them medical astrology. We are not talking about compatibilities and marriage counselings, those type of things we are not doing. That is a different perspective. We wanted to look into that, how this, if the person is suffering with cancer, throat cancer, what play, we know that the diagnosis done by the medical doctors, oncologist has done already research and done that the cancer markers are there and everything is there clearly, and he has to go for the chemotherapy, radiation, or surgical procedure, has to go through the process. So what is the planetary influence in influencing on the person like that? How we can mitigate the issue? Simple things which can be influenced that way, and when is the best time to go and find out the right time, when to go for surgery, when to go for radiation, minimize the side effects of the um, uh, chemotherapy and radiation therapies and everything. So that's the way we can work on that. Same thing with the panchakarma therapies. What is the best time to go for panchakarma therapies? Is it good to go for panchakarma therapies and everything? Or simple therapies, shamana chikitsa or shodhana chikitsa? Chikitsa means pacifying the by giving taking supplements and everything, herbal teas and oils and everything. Or they need to go to the shodhana therapy, like a panchakarma therapies can be done. So this is the way we were working on that. So we have some FAQ questions are also written there. I would like to go through that process also, some of the questions. Is there any connection between the health and astrology? And definitely, 100%. Definitely, there is a health and astrology. As I mentioned to you, microcosmic and macrocosmic. So in the cosmic level, we are all influenced. Like think about that. Solar eclipse, moon cycles, emotions, and even the ocean. If you look into the ocean, if you go to the ocean, night time, in the middle of the night, the waves are very high, tides are there. Why? We should not go there. We should not go to the middle of the night, go to the ocean. Recently, an incident happened. A Virginia girl and around drunk a lot in the Dominican Republic, drunk a lot, and at 3 o'clock, 2:30, 4 o'clock time in the early morning, and went inside into the ocean. It disappeared. That is the time to go to the ocean? No. What a foolishness that, to do it like that. So the again situation astrologically, if you look into that, the person can go and die. The death can happen by water, aeroplane crash, earthquake. Recently, people experienced the earthquake in the various parts of the world, or fire, accidents. Anything can happen, death can happen. It's not necessary that only the doshas can kill you. This is which we call as Sharirika Rogas, Manasika Rogas, and as well as Agantuja Rogas. Agantuja means accidental. So you are driving healthy and your body fitness is there, perfectly fit, but you are watching a cell phone while driving. Somebody come and hit you. How strong you are dead. So make sure that your awareness and everything is going through the process and everything, and that will help you a lot. So, Dr. Om will explain to you what are the benefits of reading an astrological chart. And There's a question is that I am afraid to know that in advance, I think ignorance is bliss. Should I still attempt astrology? Astrology is, oh my God, that is a very mathematical and complex and everything. As you learn, and nothing is impossible. It's not a rocket science. It's not a rocket science. Astrology is not a rocket science. It's a simple, and we will try to explain to you in a simplified way to understand. And there are reference books are there, some study books are there. We'll recommend you to do it. And as you are learning more and more, and you will feel that you will start to tell us, wow, this is the thing happening. I'm able to read it. First, basic charts and everything. And Dr. Om is a very patiently, he can clearly explain to you everything like that. That way we can work on that. And then do I need to know prior knowledge of the astrology to study this course? So there is no prerequisite for this course. If you are an Ayurveda practitioner, naturopathic practitioner, or medical doctor, and anybody, general public also can learn. It is a good added advantage is that if you simultaneously study Ayurveda part, that means when we are combining this Vata, Pitta, Kapha, we will also cover the certain areas. I will be teaching of a Ayurveda perspective like that. Vata constitution, Pitta constitution, Kapha constitution, Vata imbalances, Pitta imbalances, everything we are going to talk about that. So that way it will give a systematic review for you. Some of the people are already Ayurveda practitioners, Ayurveda consultants, and Ayurveda doctors are there. They will be able to. Some of the medical doctors also joining this program. That also we can give you more information that how the Ayurvedic perspective can be healing like that. Then question is that so what I learned in this course, the beginners level already outlines are already posted on the website. Eight modules, eight webinars, what are the things we are teaching, everything explained there. And also, uh, can I use this knowledge for my family and friends? Certainly, definitely. But the thing is, make sure that everything is a liability and everything is there. Don't tell anything negativity like that. Okay, you are going to die in next week. No, it's not like that. There is a chances of getting, you have to be careful. How the language we are using that level, you have to be careful. This is the period of time from July to August. That's a period of time you have to be careful not to be involved in the engaging into the fightings and evolve into the arguments and judgments like that. Those type of things you don't do it like that. That's a giving we are giving. What do you mean by I don't want to involve like that? That means that's the critical area. That is the critical area is there. That's the reason you have to be careful about that. As you are advancing knowledge and more knowledge, clarity is there for you. Then you can be very carefully to do it like that. So then lot of times what happens recently, I will tell you one story. One of my client asked that she was overweight, 230 pounds, 5'3". She's supposed to be 140, 130 pounds. So almost 100 pounds extra. And I asked her that she has cervical spondylitis and leading her to go for the, and compressions are there. The doctor is suggesting that to go for surgery. That is ultimate. She is also health professional, occupational health assistant. Now she is in disability. So first thing is that apply for the disability. First thing is that ignorance. Doctors never talked about her diet, her lifestyle. She did Ayurveda consultation with me. They directly go for the gun with that way that go for surgery. Surgery, 80% chances are there you may get benefit or 20% you may be paralyzed. She's scared. It's quite natural. If I am in the same position like that, she came for consultation. She said that I am eating a lot of sweets in my home, lot of candies and cookies and everything. I have it. That's my weakness. And you have to fix me. I will come and stay with you for 30 days. You have to fix me in 30 days. Sorry, that's too late. It's the thing is what you needed to do, which is in your control, you can do it. What you needed to do, first step is that thinking about that all the packaged foods to be put it away or donate it. All fresh foods. carrots, potatoes, all vegetables. Don't worry about any vegetable which is not suitable or unsuitable like that. You can take it, all the vegetables freshly, fresh vegetables, fresh grains, nuts and seeds, and everything. Plant-based diet follow for 1 month. It's tough on me. She is able to do it now slowly, gradually. I wanted to see the improvement as the thing. Don't worry about the weight. Automatically, you shed your weight. You started to have more clarity of mind and everything happens. Then you are eligible for Panchakarma. I cannot take you Panchakarma, but the reason is that the only one thing is that you are not completely ready for Panchakarma. You are not completely ripened for Panchakarma. Panchakarma needed to be clear mentality and everything clear. Clarity is there. Mental focus is required. Mental strength is required. Then only you are able to do. Commitment is required. That's the thing is very important in the Ayurvedic therapies. So then how this medical astrology can help her? If we look into her chart and everything, oh, this is the period of time she will be getting more beneficial effect will be there, Panchakarma therapies. See how
Just to add,
interlacing it is.
sorry to interrupt, Dr. Shekhar. Now, this is an ideal case that is actually indicating that the individual has a very weak willpower. Her mental strength is not really supportive enough to let her have that commitment with herself that she is not going to engage into processed foods and stuff like that. So apparently, her moon is badly afflicted, you know.
Exactly.
So now when we get into these kind of understandings, we can also do certain remedies of uh, moon, and then accordingly things can slowly gradually get better. So there we have to be very good at counseling as well to the individual to be able to first accept and understand the criticality of the issues. Many a times the people are not really aware of what are we going through, why is it happening to us. There's only a question of we are restless, we are this, that. No, but there are certain things that are also not contributively showing in your chart that can keep you at peace. So you have to be personally very well determined in that way. And maybe your moon's placement is like that. It is not helping you to be a determined individual. So there is where you have to do an extra effort towards those and for your own self to gain over the difficult situation.
That's great. That's great. So that's exactly what we look into, that where there is a will, there's a way. Where there is a will, there is a way.
That's the
If you
point.
are
Yeah.
ready to do it, we cannot force anybody. We can take the horse to the water, but we cannot force the horse to drink water. The horse cannot drink the water unless it has to be have a hunger. The same thing, you have to be think about that direction, that always think about that, how I can help. But if they are ready to help, they take care about the health and everything, that's very important. So that is the reason one has to have a commitment to Ayurveda and yogic philosophies and natural healings. Any medical also, people also, they need to have a commitment. Commitment is very important. Our goal is that as an practitioners of Ayurveda and naturopathy healers and acupuncturists and medical doctors and dietitians and nutritionists and all the people may able to empower them to do it more and more, then they will be successful in that direction. So then coming to this course, uh, is this course based on the Western or Vedic astrology? Master, that Dr. Om can explain to you, is it Western astrology or Vedic astrology?
Well, it is basically based on Vedic astrology. Yeah.
Good. So we will learn about we will discuss also about that. A lot of people may know about the Western astrology, but the Vedic astrology is more powerful and more effective on these things that we will talk about though. And we already talked about the course format and everything. Is there any certificate involved with these things? Yes, certification will be given to you. Beginner's level of certification will be given to you, signed by myself and Dr. Om. And will I learn how to diagnose the diseases? This question is there. And yes, because of diagnosing the disease is different. Already a person is diagnosed with the disease. A person is thyroid problem is there, hypothyroidism, skin cancer, something is there. Modern diagnosis already there, established diagnosis is there. Here, what we are trying to do it here, we try to understand the philosophy like that, how the medical astrology can be given in 8 hours of 16 hours. Of course, you will not able to learn more as you are advancing more, and we will encourage you to go for the further training programs, anatomy, physiology, pathology, and everything, disease conditions, pathophysiology, and everything you need to learn. That is the beneficial for you. This medical astrology is not only for the general public. Medical doctors can do it also. Medical doctors can be beneficial for that more and more. The reason is that medical astrology integrate to medical doctors. They also they can learn a lot, and the functional medicine doctors, those doctors also can learn more. So we have a list of the doctors are there. We'll share with you some of the screen also here. Our website, first of all, we'll share with you. That way you can see that information also on the screen. So now you have questions. Are there some questions here? Let me take this question chat box questions. So how can we get an astrological consultation from Dr. Shekhar? So I am not expert in the field. The Dr. Om is expert in that field, and he will be happy to discuss with you and explain to you how to do it in an astrological consultation like that. If you are interested in the Ayurveda part, I will be happy to do it. Then Jennifer, what she's saying that Dr. Om, thank you, a wonderful presentation overview. Dr. Shekhar, thank you for a great explanation and sharing the course details of the Om offering at each level. What is the competencies and abilities and students to expect to have? That's good. We are going to explain to you, is it affordable or anything like that? We are going to explain. It's a very comfortable and explainable you like that. And Pushpa mentioned that is a 6 a.m. CST is so early. Generally, I wake up at 4:30. Ayurveda practitioners should wake up at 4:30. If they are not waking up at 4:30, they are not Ayurveda practitioners. So that's very important that Brahme Muhutte Uttiste. It's clearly mentioned in Ayurveda. That is the thing is very important. Ayurveda lifestyle consultant only for certification purpose you are doing, or for training purpose is the practical knowledge is there. That's the thing. Always we enforce the students that and to wake up at 4:30, and that is the ozone time, and ojas is the more strong during that time. You have to wake up, do pranayama, abhyanga, svedana, abhyanga massages, nasya therapies, and everything you have to do. Dinacharya has to be done. We always talk about dinacharya, rutucharya, seasonal routine, panchakarma therapies. We talk about that. We wanted to target the big diseases, but we don't want to follow our Ayurveda principles like that. A lot of times, as an Ayurveda practitioner, sometimes my patients ask me that, Dr. Shekhar, what time you wake up? I ask them that 4:30. Why? That will give empowerment. That's the reason I call in the morning, Dr. Om. That will be in a 3:30 time, 4 o'clock time, after brushing my teeth and everything. Call so early. Yes, this is the time. I wake up in the early morning. I am fresh. So that's the thing is very important that that is the reason we kept the class at 7 o'clock. 7 o'clock means think about that. I have to finish my daily routine, then come to the class. So that is the reason. And 9 o'clock my patient starts. So 6, even the California people also is suitable for them also. 7 o'clock we are starting. That means 3 hours before. That means they have to wake up at 4 o'clock. That's a perfect time. They wake up, brush their teeth and everything, they can start working. In Canada, same thing. Vancouver, same thing. Of course, the people who are in Hawaii, those people having difficulty because 6 hours, that means early morning, 1 o'clock, 2 o'clock, that time, that may not be difficult, that may be difficult for them, but we are sending the recording to all of you. So here, Neetu Ashokan has I have a small query. Are cases where someone got a disease or any condition which is severe but is highly probable that he or she fully cured as per the planet alignment changes? Yes, it's possible. It's possible. A lot of times what happens, certain diseases, incurable diseases can be curable. That is also possible. Because if you go to the one doctor, he is not able to cure the disease, then you go to the other doctor, he will be able to cure. That means nothing is incurable. We can try our level best to missing links. That is the thing, is missing links. We have to do it like a puzzle. How in the puzzle we have so many segments are there. One puzzle is missing, it will not fill the completely come the picture. Same way we have to do it like that. Yes, continuing education, it can be done as a continuing education, as a medical astrology, it can be done as a continuing education with the Ayurveda training programs and Ayurveda training programs like that. Let me share with you the screen. I'm going to share with you, these all the questions are very good questions. And thank you all the participations, you are actively participating and everything. I'm happy. And now I'm going to share with you screen of the website, our website. And share. So this is the share of the website. If I'm going to go back to the main page. So go here all the way up. I'm going through the process. So go to the website Global Ayurveda Conferences, or if you go to the medical study Ayurveda, if you type study Ayurveda and global Ayurveda conferences.com, and there you can go to study Ayurveda segment. There you click on the medical astrology. If you do the medical astrology, that is the segment will come. Online certification. And this photograph was taken by Dr. Om. Recently in Sankraman in Bangkok, he went to all the temples and areas. Then he has taken the photo and we shared this photo on the website. Buddha. Buddha is for the knowledge. And it's very important that you can learn a lot of things from the Buddha and the teachings and everything. So the Zoom recording today's link there. What is medical astrology and how it is linked to the naturopathy and Ayurveda? That is also we described about that. Prerequisites, qualification, no prerequisites required. Everybody can join in this program. And this is the fee structure. We put it like that. Beginners level, 8 webinars, total 16 hours, 34 hours of assignments, and total it will bring you to 50 hours of certification, which is original cost is $320. We are giving a discount if you sign up for the entire program, $300. And intermediate level, 16 double, 16, 32, 68 hours of assignments and 100 hours of total, they get certificate, and 640 if you are signing for that discounted rate is $600. No installment payment, one payment, 600, 300, 600. You can pay one segment first at a time, then you can go to the second level, 600 level, 600. Then advanced level, 32 hours, 64 hours of total 64 hours of training and 136 hours of assignments. As you are growing, advancing your training program, you have to write more assignments, more studies, more clinical studies. That means what we do, we'll give a patient encounter or a client encounter. That means you may need to see your family members chart. You can prepare your family member chart. Then what type of diseases they are suffering and all the conditions like that, how you can prescribe and what are the discussions and everything. You have to write it everything clearly. We'll make sure that you are getting that many hours of assignments you are doing, projects you are doing. And then total 200 hours of training, that will be then $1,280, that is $1,200. In master level, 64 webinars, 128 and 272 hours of home studies, the assignments and everything, total 400 hours, and it brings to the 2,560, and it brings you to the discounted rate 2,400. And doctoral level, this is the very complicated here. The doctoral level where you are going through understanding in the master level also you have to give, started to giving presentations in the conferences. You speak in the conferences. You will be judges. You will be doing a lot of activities there involving with us closely. Master level students and doctor level students, they are closely working with us. So selective students will be taking and we will be sending them to various locations. So that means Rishikesh, my friend who is Dr. Dinesh Chandrasati. Dr. Dinesh Chandrasati is a PhD. He is in Rishikesh. He travels extensively various countries, and we will send him to do some apprenticeship with him. You have to go and spend time with him, see the clients and everything, how the astrological charts are there and everything is happening. More hours can be added more and more. So this is the basic level we are putting. This is then it can be modifiable and everything. And total training 248 webinars, 496 hours and 1054 hours of assignments and total hours is 1550 hours. So $9,920 dollars and you are paying $9,300 discount rate. So this is the total information about the structure of our program. Levels: basic level, intermediate level, advanced level, doctor level, master level, doctor level. All the levels are explained. So who can join? All health professionals, general public in Vedic astrology, Jyotisha, integrative medical doctors, Vedic knowledge seekers, energy healers, Reiki masters, yoga teachers, psychologists, psychotherapists, physicians and physician assistants, cognitive therapists, pranic healers, nurses and nurse practitioners, therapists, yoga teachers, artists, complementary and integrative medicine professionals, social workers, other allied health professionals, educational administrators, first responders, Ayurvedic lifestyle consultants, Ayurvedic health counselors, Ayurvedic practitioners, Ayurvedic food and nutrition consultants, Ayurvedic yoga therapists, Ayurvedic doctors, naturopathy doctors, mental health counselor, pastoral counselors, physical therapists, recreational therapists, dietitians and nutritionists, occupational therapists, massage therapists, yoga wellness coaches, community organizers and activities, peer counselors, caregivers, coaches, clergy and faith leaders, military and veteran providers, teachers, guidance counselors, school and university support staff. So we are trying to give the all levels of people. We are going to work with them to bring them beyond and above. So this is the previous meeting we have done, a Zoom meeting, which is Dr. Om and myself. We have done the things, meeting proceedings and everything done. This is the Vedic astrology meeting and how the things are there and everything we have posted there on the website. So this is the page what we do. We talk about that. A lot of information is there and everything we posted there information. You can go through that process. So we are the main faculty members. 2 teachers are there. Myself, Dr. Om, and their backgrounds and everything is the practice and everything since practicing. These are the FAQ questions. As we are adding more and more questions will be added to that FAQ questions we have taken. And this is the form where you are filling the form. This is the medical astrology webinar certification program. So this is all the form. So in the basic level, this is all segment there, and you fill the information and everything. And medical astrology beginners level, where you are signing here. The beginners level of certification will be taught by Dr. Om and Dr. Shekhar. 8 webinars, 16 hours certification as approved by the APNA, Association of Ayurvedic Professionals of North America, USA. Intermediate level and prerequisite is that a completion of beginners level training program. We cannot take you direct level. For example, we already completed in July 10th, we are tentative date, we are given the date, auspicious date, July 10th. August, September 10th, almost September, mid of the September, you finish the program. October, November, you will have assignments. In the month of December or November 15th afterwards, you will have assignments to be written to us. 2 months time, 2 months training, 2 months these things. Then at that time, we will have a challenging questions are there and everything. We are taking project work and everything. Once we are done that one work there, we will try to send it to all the editorial board members to review it, your article and everything, what you wrote it. Then once the published and everything is proofreading and everything is done, then we'll approve it, and then finally you will get a certificate as a beginner's level training program. So in the month of November you are getting, and then we'll give us some gap to digest and everything. Then January we will start a intermediate level program. Only we are going to take the beginner students, only they can eligible to go to the intermediate level. Nobody cannot come. That's the reason we are giving the time for them. Somebody, oh, they are very much interested. They wanted to study more. But what is the problem is that they have missed the classes. We'll send the recording to them, all 8 recordings. And after recording and everything, they start doing a homework and everything. If they don't return, if they are not qualified as certified beginners level medical astrology certification, they cannot join into the intermediate level. Sorry, because they can stop there. That's it. That's the reason what we are trying to do. We are very strict in that aspect. We wanted to be enrich the knowledge and everything for the purpose of these things. Very reasonable price. If you look into the pricing, also very reasonable. Nothing is expensive here. We will try to do it such a way. Then eventually the price may go up. It may charge you to the $600, $1,000 for the beginners level will be there. But the thing is a very reasonable prices for now, people who are interested. And not only that, you also inform to your friends, because always we recommend them study buddy. You need to find a study buddy. Study buddy is very important in the learning process. So while you are studying the bachelor degree, master's degree, doctoral degrees, always, even now I have my study buddies, still I continue with them. I have study buddies, 22 study buddies while I am studying BAMS course. My MD course, my study buddies are there. So those are permanent friends. Even 35 years later, 40 years later, I'm communicating with them. So that is the reason very important that you have to have a study buddy. Definitely every person has to bring 1 or 2 friends, their friends. That is your responsibility to bring the people. That way you will know the familiarity. You can have a discussion group is happening there. You can have private discussions with them. You can have Zoom meetings with them, FaceTime meetings, WhatsApp meetings. That way you can have a conversation is going on like that. Then advanced level, if you go to the advanced level, this is the training program. Again, you go into the master level program and doctor level program. So in the individual webinars, what we are going to teach, that is also we written very clearly. So for example, your friend is interested, only 1 class. We don't give any certificate. They wanted to come for the only webinar 1, Introduction to Astrology, 40 hours, $40 they have to pay. And the foundations of medical astrology, understanding the body through zodiac signs, planets and their influence on health, health indications in the birth chart, medical astrology as diagnostic aid, case studies and practical application, ethics and limitations in the medical astrology. So these are the 8 segments we are going to look into that. 8 webinars and 2 months you will be learning. Next, intermediate level, we'll go to the only students who have completed the basic level with certification, with approved certification from us. Sir, I have already done my training program with some other institution. I got a certification. Still, you need to take certification from us. Our teaching style is different. Other schools may be differently teaching. We are more focused on the medical astrology. Our experiences we are going to share. So webinar 9, 10, 11, 12, 13, until 24. Then we are putting also advanced level of training. We are putting the topics and everything. We are working on that. Advanced level topics will come. Then the master level, all segments will come. And then doctoral level, all the 248 webinars total. So they're systematically done. There's no refund. Once you pay the money, there's no refund. Unless we cancel something like that, that's a different, we can give you a refund. Once you pay, full refund will not be given anything, no partial refunds or anything. We'll pay for that. We'll continue working with you and to teach you and everything. The webinar dates also will give you the dates. Sometimes some holidays may come and everything. That's the reason we have to be flexible like that. We try to do it on Thursday. Thursday is a fixed day that way. Thursday is very important. And Dr. Om can explain to you why we are choosing a Thursday as a special day. So this is remember, this is the page you can go in the Global Ayurveda Conferences or studyayurveda.com, and studyayurveda.com. There you can see the medical astrology, the first segment itself. There you click on that, you will see the medical astrology. Whole page is there. All the information is posted in one page. So Dr. Om is fascinating for me because auspicious dates and auspicious time, auspicious moment, and all things are very, very important. A lot of times it's good to learn. The students also seeking for this knowledge, wonderful knowledge. They always look for the, because as much as you study more and you want to grasp more knowledge, that's the reason we have thought about that. Maybe Wednesday is a good day or Thursday is a good day, like that. We thought about that. Finally, Guru. Guru means teacher. Guru means heavy. The knowledge is heavy, is learning from the teachers. And certain people, they can be coming and teaching us. That will be helpful for a lot. What is the importance of Guru? The Thursday is important. Why we are starting and teaching students Thursday?
Well, as for in the astrology, we consider Guru be the wisdom giver. So, and this is the Vedic wisdom that we are trying to approach here, you know. So we need the special blessings of Brahaspati, the Guru Devata here. So that is why, although as you mentioned about, we did discuss about Mercury. Mercury, the significator of education is Mercury. So when we are talking about intellect, we are talking about any subject knowledge, education in general, it is seen from Mercury. But as we want to really get the blessings, and without the blessings of the Lord or the governing planet, we cannot really get blessed with the knowledge or the wisdom. So that is why we want to get the special blessings of Brahaspati Devata, and that's why we want to keep it on a Thursday.
Thank you very much. So we have also, as I mentioned to you, we have also adjunct faculty members. We have Michael Mastro, who is based in California, USA. He's expert in the Vastu as well as astrology. And he is also medical astrology. Also, he teaches in our conferences. He is associated with APNA and organizations like that. We will be taking him as also one of the adjunct faculty member to giving to the advanced level of training programs. When we are going to the advanced level of programs, where we will go, because basic level, he is also very, very busy, but we have to capture him and hold him and bring him, and all the experts of the adjunct faculty members, we are going to bring them to shed their knowledge and everything. Then when they are talking about that, hey, our students are well trained, and Dr. Shekhar, Dr. Om, you have trained your students very well. We are going to ask the questions like that. They are able to answer these questions. They will feel proud. They will feel happy. That's the reason we wanted to expose to you all of our students to the higher experienced teachers, and they have wisdom, and also we are also able to learn some wonderful knowledge from them also. That way we are always seekers, knowledge seekers, and that's the thing is very important for us to share with everybody, to learn from everybody and understand these things. And then medical astrology conferences we can be conducting in future like that, and that will be helpful for everyone to do like that. Now actually this weekend and now next coming weekend we have I would like to share with you, all of you, and you may be interested in these things, and let me share with you. And if you go back to our share and go back to our website again. So here, go back. Oh, yeah, that's better. Okay, now if you go to these things, conference, we are having conferences coming up that is called Ayurveda and the Mind Conference on May 1st to the 4th conference. We have about more than 150 people are participating. Some of the people who are in person coming, there are some people are coming participating online. So the only 4 days left, 4 more days left, countdown. And for that, people who are not able to in person coming, it's difficult for them to come all the way from the various parts of the country, then they can also participate online. Zoom virtual registration can be done. So this is the price is going on right now until 28th, 2 more days, $250 we are charging. So then final registration after 28th, they are paying $300 registration fee. And this is the click here, then you will take you to the thing. And if they wanted to come in person registration link is there. This accommodation link is there. Sponsors and exhibitors, all the information is posted there. And this is the podcast, I did it. And then we have also, these are the all the speakers. We have Michael Mastro is here. Michael Mastro is speaking also. And we have also Dr. Om is here. Dr. Om is here. Michael Mastro is here. All the different speakers who are there, and Michael Mastro is here. So all the speakers, we have 35 speakers who are speaking on this topic like that. And the nearest airports and everything, and even the medical astrology, and that's mentioned here, detailed information like that, and highlights of this program, 30 reasons to join in this conference we are doing. This is the 67th conference. And we have laughter yoga, yoga alliance certification, sponsors and exhibitors, online Zoom lectures, and various things are happening. These are the organizers. And Dr. Vasantalad is giving presentation, and Dr. Smita Naram, keynote speakers. These are the Shanmugam and Dr. Zuluvan, Anil Maheshwari, and Suresh Swanapuri from Ireland. He is all the way from coming from the Ireland to speak about that. And conference moderators are here, and featured speakers, of course, including me also. I am presenting on the topic of the Ayurveda and bipolar disorders, management of bipolar disorders, how the Ayurveda things are there. Everything is posted there, all the speakers and everything. And all the topics are there, various topics. So we'll have a discussion, a panel discussion, and again, special lectures. And everything is posted there here, all the information, all the speakers and everything. The poster presentations are there. There are 11 poster presentations are there. Andy is here. Andy is one of the student and studying of Ayurveda, and he is giving presentation on the poster presentation. And this is the program schedule, morning. So this is the Thursday we start, and afternoon 2 o'clock we start. And then it is having until almost 8 o'clock. 9 o'clock we have a class. And Dr. Om is talking about mental health remedies through medical astrology. Dr. Om from Bangkok. He will be speaking on that day. We got already video recording and everything. It's a very fantastic. And we can be broadcasting that information on that day. And Friday, again, morning pujas and everything. It's a fully packed program, fully packed. I work hard. I make my students also work hard. That's my nature. I push myself, I push my students also. That's my nature. Then only you will get it. If you wanted to squeeze the oil from the sesame seeds, you have to crush it. You have to squeeze it to get the oil. If you want to get a juice from the fruit, apple juice, you have to squeeze it. Then only you will get a juice. So same way, I always feel that if you do hard work, you are getting results. That's the thing is very important. So commitment is important. As you are empowering yourself, then you will learn more. So that's the thing. And all the programs schedules are there. Saturday, beautiful breakfast is there. Morning yoga is there. Whole programs schedules are there. Sunday. And this is the award ceremony we are doing. These are the recognizing them 2 speakers and a lifetime achievement award for the Ayurveda, Vaidya Smita Naram and Dr. Zuluvan, Dhanvantari Award, and congratulating them. And these all the speakers, their biodatas and everything. It's posted everything in one page. Everything is there. That way you don't need to, you don't lost anywhere. Okay, these are the speakers and their backgrounds and everything. All the speaker. This is the one girl. She's my student. She's studying Ayurveda and now sound healing. She's going to do sound healing practical and demonstration. All the speakers. Kundalini yoga. She's also another expert of the penny pharaoh. Is an Jyotisha and inner organs of the body, like that. So we have 3 lectures in this conference, astrology related, medical astrology related. 3 lectures: Penny Farrow, Dr. Om, and Michael Mastro. These 3 people are giving on the special topics on these things. This is the thing we are involving, and these are the college students who are giving presentations. Swamini, Panchakoshas and daily lives, and diet, nutrition, yoga, and Dr. Om here, and Chris Casely, Neil, Michael Mastro, and Suprakash Mandal, who is a medical doctor, who is talking about these things, and myself, Master Kamal, who is a yoga expert. We are giving a video clip, and Swamiji is talking about stress management, is a guided meditation. Yoga teachers are giving some presentations, and scientist who is a PhD scientist in the Johnson, he is giving about the how to grow your medicinal garden at home, mind power boosting herbs. And Mukund, PhD, is giving an online presentation. Leah Quirk is one of my student. He's a medical doctor, MD. Christian Comte is a medical doctor, board certified psychiatrist. A new perspective of mental health management. And psychologist, priest, homum, we are going to do it. And organizer for this management of these things. Sudhatma Chaitanya is the manager for this center. Poster presentations. All poster presentations. And Arsha Vidya Gurukulam, the description about the location where we are holding the conference. There are the speakers who are coming, and with the book writing, they have written the books and everything. They're bringing the books also. That will be helpful for you to speakers registration page and participant registration form, sponsors and exhibitors registration form. So that is a complete picture of the entire page of the information. Everything is posted there on there and website. You don't get anything, but the chance is that now only 4 days left. We have students from the Brazil and Canada. Today morning I saw the Canada, and some students from the USA, and I think Europe also somebody joined. So we have an online, some of the students who are joining. You can register online, and that way you will get all the, and those who are registered students for the Zoom meetings, Zoom recording for the 25 hours of continuing education, they will get it, PACE credits. That's called Professional Ayurvedic Continuing Education. PACE credits, they will get it, 25 hours of for the conference. So after, there's no test, nothing is there. First, once you get joining and everything program, then after finishing and everything, we will send you a certificate to you by email, digital certificate. Then you can print it at home. So that's the thing we are going to do it. That will be continuing education for the people who are practitioners. But inform to your friends. That's the thing. But if physically, if you are coming, you are able to participate in the homam and laughter yoga and morning pujas and yoga classes, those type of things you can do it, and also interact with the people, meet with the people, professionals and everything. We got a huge banners and everything, and we are going to push that way. That it's a very cordial relationship and everything, very friendly relationship there. We are going to do it. And any other questions you have, we are open to take questions, and Dr. Om is here, and share with your questions. You have a chat box, some questions are there. Good, wonderful experience. and Michelle Gallant, and you can register. Is this the first time you are doing this, starting this program? Yes, this is the first time we are doing certification program, but we did consultations and regular consultations we are doing, but the training program first time we are doing, and first and best we are doing, and that means if you join waiting for the next class, when is going to happen like that, it may be 2030 or 2028, we don't know. Maybe whatever we are doing, we are advanced because we are teaching an advanced level, so program is not going to come back. Like you have high school, you passed, and then you don't go back to the high school again. You will go to the bachelor degree and master's degree and PhD level. You may be teaching some high school students. That's a different story. Sometimes maybe in future our students may be teaching basic level training programs in future. That's the thing, we are going to do it. Our students will be empowering, and our teachers, our classes will be a master classes that will be taught, and at the same time syllabus can be modified and everything. The pricing can change also. As I told you that now pricing is $300. Now it may be changed to $600 also later stage. Maybe next year $400 and $500, $600 also. The price changes according to that. There is no guaranteed price like that. But the thing is very important that we are expecting to have 100 students in this class, and we have more students, more better, because more interactive sessions are happening, more connectivity is happening, more enthusiasm also comes to us, more bringing of knowledge for you, all of you. That way in a Zoom meeting we can attend as many as people like that. So not necessarily the 100 students who are registered, all people may not able to come, and some students, they may be they have other commitments are there, they are still sleeping, and they are not following the Brahmi Muhurta time. So, but still, but it will come to their home, that will come to their mailbox. They can read it according to their own convenience time. At night, sometimes they are saying that way, and sometimes people they send the emails to me at 11 o'clock night. That means they are not sleeping. They are not. They have a sleep apnea problem or a sleep disturbance problem. So that is the things. The Saturn is sitting on their head. Saturn is sitting on their head. That is not allowing them to sleep. So you need to invite the moon to come to your brain. Moon. If you bring the moon to your brain, you will fall asleep like a baby. So next month we are going to do one more webinar, free webinar, and next month we are going to do in May 31st. May 31st, we will be sending the recording, the Zoom link for you. You have to register again. Zoom May 31st, that is Saturday, at 8 a.m. same time, 8 to 10, around 2 hours time, we will be doing that webinar on the insomnia, particularly talking about insomnia and people who are suffering with insomnia and everything. We are talking about that. But of course, we talk about the same thing, information. Some newcomers who are coming, we'll talk about that. In addition to that, we'll talk about the specific topic about insomnia and how the people are sleeplessness and everything there. That's a major and the crisis problem in the majority people are not able to sleep. That's the reason we are trying to keep it in the morning hours. Of course, in this month period of time, you will wake up early, you will raise, and yourself you can come. Even though 94 people registered for these things, we have only 25 people able to come. So 25 people able to come. But what we are going to do, we are going to send all the people, 95 people, we are going to send this recording after YouTube, convert it to the YouTube. Then we are sending this recording, and we are also posting this link on our website. That way you are able to not missing anything. All the information is posted on the website systematically. It is there, and you are able to connect with each other. Any other questions? We are happy to, chat box is there open for that way. We have some more time, even though beyond the time we did it, and we have covered everything, and good, very good. Thank you one and all. And before closing the session, I wanted to chant a Dhanvantari Stavanti closing ceremony. नमामि धन्वन्तरिमादिदेवम् सुरासुरैर्वन्दितपादपद्मम् लोके जरार्भयमृत्युनाशम् दातारमीशम् विविधौषधीनाम् ॐ शान्ति शान्ति शान्तिः हरिः ॐ Thank you one and all for joining. Please inspire your friends, colleagues, share the link to all of you. Those may be benefited like that. This is the thing is very important. Knowledge should be shared. Knowledge cannot be stale. It cannot be stale. It has to be fresh. We have experts are there. We are going to bring more people. As I told you that 100 is not a limit. Even if we get 1,000 people, we are ready to take 1,000 people online. Whether you are teaching one student or 1,000 students, there is no difference comes. Even we can get more students come, more better. And if you are feel comfortable like that, then you can take you to the no pressure to come to the next level class. Then as you are feeling comfortable, more confident and everything, then you will be able to do it. Yes, this can be online. YouTube recording will be there. After that, after doing this session, we will be converting entire 2 hour session will be recorded in the YouTube. We'll be posting to these things and we will be sending the YouTube link to you, all of you also. That way you are able to see and watch what is there. Remember to go to the globalayurvedaconferences.com or studyayurveda.com. Study Ayurveda, click on medical astrology. There you can see. And thank you one and all. Jamaica to everyone. Thank you very much. The Jamaican people, I was in Jamaica also, Kingston, Jamaica. I am able to teach some classes there and cooking classes. I did a cooking classes in Jamaica, Guadeloupe, Trinidad, Tobago, Martinique, Aruba, all the islands I traveled, and Bermuda also. I traveled Bermuda also, all the travels and these things, Canada, and of course Switzerland, Germany, France, Italy, Portugal, Spain, Belgium, all the UK, United Kingdom, Ireland, and entire Canada we traveled, and almost 30, 40 states in America I traveled also teaching these Ayurveda programs. But this is the fascination for me. I felt like that I was so connected to that way. And previously we were teaching about mantra therapy. Mantra therapy, that is also Master Dr. Om, when I mentioned that, yeah, we need to have mantra therapy also required. What we are going to do, we are going to take Pandit Neil Sahil Parmeshwar is one of the priest, a temple priest, is full-time temple priest. He is going to bring him as an adjunct faculty into these things, expertise. We are going to bring them expertise, all the expertise, and they will give a special sessions for you how the mantra therapy, what mantras can be useful for these conditions that we are going to bring them in these sessions in Zoom meetings. Okay. Thank you one and all for joining. Namaste to all.
Thank you, Dr. Shekhar. Thank you so
Thank you.
much.
Thank you.
And thank you everyone for having joined.
Thank you.
Really appreciate your time. Thank you.